Welcome back to another episode of I'm Not a Doctor, but My Wife Is. Today we have Melissa Indot here. I'm absolutely honoured to have you here with my co-host, Dr. Mantalia, who is the founder, medical director and functional medicine practitioner at the Rosewood Clinic. So Melissa, today we have an incredibly interesting topic. Now before we delve into it,
Okay,
I'm going to ask you a little bit about yourself and how that ties back to today's topic. Because today's topic is midlife mindfulness, navigating perimenopause.
Ooh. Wow.
It sounds a massive topic, right?
Because it is.
Yeah.
It is.
Is it?
Yeah.
Do men appreciate, and it's going to just jump straight into this, do men really appreciate this as much as it should be understood?
That's a very loaded question,
I know.
first of all. Let's just get very, well, first of all, I want to say thank you for having me on the podcast.
Yeah.
So, can you just repeat the question again?
Yeah, because, I mean, as I just mentioned this perimenopause, it is a big topic, as menopause is as well.
Yes.
And as I just said it and words came out of my mouth, I felt like I wasn't prepared for the topic.
I feel like no one really is prepared. No one can ever be fully prepared because, and I'm sure Dr. Iwan will add to this, we're all different, right? We're all unique individuals. So with the amount of information that's out there, and probably in the last 50 years, there's more information that's been out there. But before then, very little information, very little knowledge about perimenopause and menopause for women. And we'll get into the details of that later. The point is, with all the information that is now out there that can prepare you, nothing can prepare you for an experience that's going to be unique to you. Right. And with all the different experiences that different women have out there, it's very possible that you won't experience what they experience. So that's what I mean about being prepared. It's good to kind of read up and know how different women experience it. But really what's important for me is getting reconnected with your own body, cultivating your own body awareness so that you notice what changes are happening within you. Rather than looking for changes that are happening in other women, you're becoming more aware of what's happening within you.
Got it.
That's one part of that question.
Well, I've got a lot to learn, haven't I? And hopefully by the end of this podcast, I'll be enlightened. So Dr. Mann, we are honoured to know Melissa because you've done a workshop in the clinic before. Now that, correct me if I'm wrong, that was a sound bath?
It was, there was it closed, I closed it with a sound healing session, a sound bath, and we talked about self-awareness.
We did.
Sort of extending from what I just mentioned, being mindful and being self-aware of your own body and what's happening in your body from a health perspective, whether mentally, emotionally, or physically. We tend to go to the doctor when we have a runny nose to reconfirm something we already know, right? I have a cold. And that's not to take away the importance of getting professional advice, but I'd like for everybody watching to really ask yourself, how self-aware are you? You know, do you need someone to tell you something you already know about your body, or are you going to the doctor to support or to facilitate a healing process? They're two very different things.
So before we jump into this as well, tell us a bit about your background. Now, I know that it's very interesting. I mean, I know that there's a singing aspect to this as well. Please, enlighten us.
My goodness, where do I start? Well, I've had a career in accountancy, so I was an accountant for 10 years. That's a very little known fact. And then I'm very passionate about music, so I also have a career in the music business in the UK and here in Malaysia. I've sort of semi-retired now from the business, but my passion is very much music because I believe that we are music. We have a frequency from which we live from. Our voice is music. It's very important for us to speak up. And when it comes to health, when we're not living well, when we're not listening to what our body needs, we're out of alignment, and that frequency is affected. So I had a career in music, and life threw me a couple of really big curveballs. My father was diagnosed with cancer, stage 2 cancer, nothing really serious. And within 6 months, he passed on because of complications with the treatment that he had. And then 2 years later, I lost my soulmate also to cancer. So I had the opportunity, I'll say, to be primary caregiver to two people who were very important to me. And you know, when life throws you these curveballs, when life ends, it made me really question why are we actually here. And also made me question how I was living my life. Made me question the medical system, how things were being run, and maybe we'll delve into some strong opinions I have about that. But you know, whether the medical field is more about fixing than it is about healing, whether it's more about treating a symptom or looking at the root cause. So that's I think why I'm so excited about having met both of you and the work that Rosewood Clinic does. So those life experiences pivoted me into my personal growth and healing journey. And in that journey, I had a bit of a spiritual awakening as well. So I studied the ancient wisdoms of Ayurveda, yoga, traditional Chinese medicine, and studied many of the spiritual sages, and did a lot of personal growth work myself. So I had a lot of coaches and mentors, and I kind of really dived into, ask the question, the proverbial question, why are we here? What is the purpose of us being here? And how I could improve the quality of my life so that I could really validate my life. Am I existing? Are you existing, or are you living? And if you're living, what does that mean? What is the quality of my life? How does the quality of my life affect the way that I contribute to society, contribute to the world? I contribute to humanity. So some very big questions. And in that period of my own self-study, I realized that there was so much more that I could do with what I was learning about myself, which is to help others, to support others, to be the person I needed in my hardest days. And I've journeyed alcoholism, I've journeyed drug dependency. I was a high-functioning addict for more years than I care to mention, and dived into my own sobriety journey. So many stories that have brought me to where I am today, which is essentially to be a guide and support, predominantly to women on their healing journey from a holistic perspective. So mind, body, soul, spirit, really to show up as the person that we're born to be. Because we're told many things. We're very much influenced by our parents, you know, our lineage, our culture, our country, our nationality, our tribe, the media, our friends, and all these influences potentially pull us away from who we truly are, from what we know to be right and true for ourselves. Because of what society tells us or conditioning tells us, we often abandon parts of who we are to fit in.
Got it.
And that is a misalignment that causes disease within our system, which disease is disease. So just to summarize, my calling is to help, is to support people to come back into alignment, to live within their purpose, to come back to living according to their unique human design.
So you're bringing your life experience to bear here, and I'm sure over the years as well that has, played. It's really contributed to your work.
Yeah.
Whether that would be singing, whether that would be what we're talking about today.
Yes.
So, Dr. Iman, I want to bring you into the fold here as well. We're talking about perimenopause, but perimenopause is, and correct me if I'm wrong, the first phase, or I wouldn't use the word first, but the first phase, you've got perimenopause, menopause, postmenopause. Now, there may be more phases here as well, but where does perimenopause fit into this? Just kind of set the context for us today.
Okay. So basically the medical definition of menopause, the average age for menopause is actually 52, 53 years old of age. Okay. But with perimenopause, that natural transition that happens just before menopause, so this is what we call perimenopause, it's like 7 to 10 years before that. And so this is actually because the egg reserve is dropping. So as women, we're actually born with a set number of eggs, right? And so then when we reach 30, that number comes down, and we were talking about that from the fertility podcast, right? And so at 40, it's really, really low. It's down to 2 to 3%.
Wow.
Yeah. And so that then causes all this kind of chaos, because the brain is sensing that we've got very little hormone, estrogen especially. Because the whole process of, that natural kind of menstrual cycle every month, that ovulation process is actually what drives hormones. And so then now you're having less eggs coming out every month. And so now the brain senses, okay, we've got very little estrogen now. So they're actually, sending out signals to the ovaries to produce more hormones. And so that this is where there's kind of like this, it's not matching. And so you get this kind of chaos, zone of chaos, what we call it.
Us men don't know how lucky we are.
Yeah.
Really? We don't have to go. I mean, we're simple creatures, aren't we, Melissa? I'd say we're simple creatures.
Yeah.
Rather not comment on that.
Okay, fair enough. Moving on swiftly. Okay, so, I mean, both of you please share this one as well. When you talk about symptoms in perimenopause as well, when, you know, like you say there as well, menopause may be around the early 50s, but up to 10 years or even more, because I understand that sometimes you can get in the 30s. Yeah. Your perimenopause can kick in the 30s as well. What kind of symptoms are we looking at?
Okay.
Can I just ask a question as well, Melissa?
Yeah, of course.
Have you been through the experience?
I'm definitely at the tail end of my perimenopause right now.
So having been in that as well, maybe you can give some if you don't mind sharing as well.
Sure, yes, absolutely.
A bit of an idea about the symptoms from a medical perspective, but also from a personal perspective.
Yeah, sure.
Let's shoot. I'm interested.
First, okay.
Go for it.
For me, definitely the symptoms. I'm actually experiencing it right now, which is like a hot flash. Yeah, you know, and I'm sweating, and it really comes out of nowhere, really out of nowhere, and it can be very extreme. It can be in many ways, I would say, frame as embarrassing if we're out somewhere and suddenly my whole shirt can get wet from sweat, just because I'm having a hot flash. Right. So that would be one major one that I experienced during my journey. Thank goodness it's lessening now. Yeah. And it's no amount of drinking lots of water or anything can control that. You know, as Dr. Iman mentioned, it's just my hormones, running wild. And another one for me has been increased anxiety. Also comes out of nowhere. I can be in the car listening to music happily, and suddenly I feel tightness in my chest and butterflies in my tummy, and in my mind I'm asking myself, what are you anxious about? Actually, I'm not thinking about anything that's fearful or worrisome, but my body is going through a physical experience of what I would call anxiety. And then suddenly I feel fearful. So that hot flashes and cold sweats, anxiety, and the one that I feel I've suffered the most from has been incredible mood swings.
Right.
Yeah, so just having a perfectly normal day. And my mood swing actually goes more to, at one for 2 years it was depression. So I'd go from okay to just like rock bottom.
Immediately?
Yeah, just like that. Go on a morning walk, happily, enjoying nature, the birds singing, and suddenly I'm like doom and gloom, the end of the world.
Yeah.
And it was either depression, or the other end of the spectrum for me was fury. Not even anger, but fury. Like I needed to break something.
But could anything trigger that?
Yes, and literally there wouldn't even be a trigger. That's the thing. At least I could blame a trigger. This is like out of nowhere,
Wow.
Yeah.
And how did you, when these first started, these triggers first started happening, these symptoms first started happening, how did you manage it?
Well, first of all, and I think it's important for all women to realize this, is when it first happened, for me at least, I didn't realize it was happening. I didn't realize it all for months. And maybe even years, in fact, because I could even say to you now, in the whole of 2024, I was reflecting, because I was researching more about myself and the perimenopause journey, and I thought, actually, I think my journey started much earlier than I realized. And now all the ways that I was suffering during those years, suffering depression, suffering a hard life because the world was being so cruel to me, was actually me going through my early menopause stages of extreme emotional swings from my hormonal changes. The world was not being hard on me. I was just angry because my hormones were running wild. I would say there's no valid reason, no logical, rational reason for that to happen. But the reason it was happening that is logical is the fact that my hormones were running wild. Wow. So, short answer to a long question is, don't be surprised if you're not even aware that this is happening. So, partners out there, it's also important for husbands and partners, and wives, right, to notice that if there is an extreme change of behavior in your partner, that this might be a symptom of perimenopause, looking at the age as well.
Yeah.
And no matter how many questions you ask, like, are you okay? Unfortunately or fortunately, being the partner, you're going to have to ride. I won't say you have to. You get to accompany your partner on this journey. Because I think the best support you can be is to be present and it's to take the knocks actually, in a way, because the more you try and push back on it, there's no fix.
Right.
This is part of the process of life, basically. To cut a long story short.
Dr. Mann, are these common symptoms? Because these are three core symptoms that you as an individual
Yes.
went through.
Yes.
Now, women suffer, and they do suffer from different symptoms. What
Yeah.
other symptoms can manifest?
Okay, so what Melissa mentioned there, the hot flashes, night sweats, so that's the very well documented symptom for perimenopause, menopause, right? The vasomotor symptoms, basically. And it's like, it just comes out of like nowhere. And then, you just kind of like get drenched in sweat for a lot of women, and some women don't have those symptoms. So it's just very different, it just varies. Like in the clinic, I see a lot of these kind of different symptoms. Some women say they don't have any night sweats or, hot flashes. It's like brain fog, a lot of brain fog, just losing,
Yes.
the words.
Are you
Or just-
calling brain fog there?
Calling that
Okay.
brain fog, definitely.
Yeah, that's a very common one. But like in research, the very well documented symptom is actually mental health issues. Yeah, so the decline in mental health. So your cognitive function actually takes a hit, and so then that's why a lot of women go through kind of depression and anxiety at this phase. Unfortunately, like you said, you don't even know that you were going through that. For many years, we were not even talking about menopause even.
Yeah.
Like, it's something, most women don't even talk about it. It's just very taboo. And now we're actually talking about perimenopause. Like what are the symptoms that women go through, So research, there's not much research on it as well, but now it's changing. For many years, the research were centered around animal models like mice, not really human, but for the last few years now it's changing. And so then the understanding of perimenopause, menopause was very poor before. And so then, how do we expect women to actually, understand what they're going through, right? And so, but now I'm glad a lot of women are aware about this, and a lot of practitioners like Dr. Mary Claire Haver, Dr. Mindy Peltz, they're talking
Yes.
about it, right? And they're
Yes.
bringing awareness to a lot of women. And I think that's why now women, I see a lot of women in the clinic coming in to kind of like, understand, okay, is this perimenopause? Am I going through perimenopause? What can I do to actually alleviate this? Or how can I kind of go into menopause, like in a smooth kind of transition, because this can be rough, but it's also important to look at other aspects of it, because sometimes it's not actually perimenopause. I was just talking to you about it the other day, right? I had like 10 women coming to the clinic that week, and all of them were asking me if they were actually going through perimenopause. And so then when we did a lot of tests, went through the discovery consultation, 9 out of those 10 women were not going through
wow.
perimenopause. Yeah. It's
Okay,
just,
I want to know what they were going through.
yeah, so that's the thing. It's a lot of other things like, nutritional deficiency. We do see a lot of women with iron deficiency. It could be a vitamin D deficiency. I do see a lot of women having severely low vitamin D levels, and they do have those kind of symptoms, like body aches,
Brain fog. Because iron...
with iron, yes.
Yeah.
Yeah.
So with iron deficiency, you can also get brain fog as well, muscle cramps, joint pain, headaches. And so, that can overlap with symptoms of perimenopause. And so that's why we're doing a lot of other tests as well, not just the hormone test, because at perimenopause, it's a little bit tricky to kind of look at hormones as well, because you get all those kind of fluctuations, those zone of chaos. And so then, it's also important to rule out other things. But the symptoms can vary so much.
Now, these 10 women, they knew something wasn't right. Hence, they came to the clinic in the first place. And to come to our clinic as well, you've got to do research.
Yeah.
You've got to be interested and go, hey, they're also aware and conscious of their own bodies, or someone has said something to them, and that's the reason they came in. But what about other people? And you mentioned something very interesting there, and I wrote this down here. How can men, partners, women, support their partners? They realize something has changed in their partner, and it didn't happen overnight, or maybe it did happen overnight, but it's happened and now it's 3 weeks, 4 weeks, 1 month, 2 months, 1 year. And how do you raise this and say, hey, look, I think it could be this, we may need to address this?
Yeah. There's a no one size fits all, obviously, for life in general, right? But in terms of a partner, what I would say is understand that this is not something that can be avoided, number one. This is not something that can be fixed. Perimenopause is part of the process of life, and it's no fixing. And I say this, I use this word particularly because language makes a big difference. And as men are conditioned and taught to fix. They want to come in and fix. They want to come in and rescue. And you know what? It's a beautiful thing. But it's not aligned with the perimenopause journey and the healing journey and a life process journey. So it's the first thing to kind of assimilate mentally for men in particular, and it's conditioning. Okay, it is gender biased in that way. I know because I've worked with women and men. Can I say this is fact? Go Google it, find out for yourself. But yes. And if for anybody else supporting a woman, whatever your gender is, I think the invitation would be to just be present with them and just to observe them, not make any suggestions, in fact. Just be with them when they're going through that period and ask, what do you need?
How can I support you?
That is the best question. Yeah. What do you need? Oh, I don't know what I'm going to need, right? I'm reliving my craziness and my moments. And okay, how can I support you? Just like you say, Greg, what can I do to support you? And really be with them. And one of the most beautiful things that my partner said to me, and I raise my hand and I say, I have been an absolute, in air quotes, monster. I cannot control this. A lot of the time I'm not aware it's even happening. And the amount of shame that I feel after the fact, when I've had a big tantrum, when I've behaved in a way that is unkind because of my hormones. I said, I can't even begin to tell you the amount of shame I feel, and I'm sure many women feel the same way.
Can you apologize for that, or do you just...
Well, this is what I do. This is what I'm suggesting as well, is that you just own your experience, Do I apologize for experience? I've learned not to. Because how can I apologize for something I didn't consciously do? Yeah. All I can say is I'm very aware my behavior was unkind. And I wouldn't want for it to be that way, and I'm doing my best, but I cannot control this right now. One of the most beautiful things my partner said to me is, I have accepted the fact that you are going through this phase in your life, and as your partner, I'm going to choose to be with you. And there are going to be those tough days, and I will just take it. I will take it. And I said, please, in those moments when it gets too much, tell me. Take that time. Go and do whatever it is that you need. Whatever it is, don't self-sacrifice to be support for me. So it is a tricky cycle or chapter to navigate with someone. The most important thing for me, I think, is communication.
I think you're right, because from a man's perspective as well, if I turned around and said to my partner, for example, and I mentioned it something like you say there as well, and she turns around and she says to me, I'm fine. I'm no different than I was last week. Yeah. I don't know what you're on about. You're talking nonsense. Yep. I'm standing or sitting there and I'm going, what do I say? What does a partner say in reply to that? Do you just suck it up? You have to suck it up.
Well, I think for me, again, my approach would be, okay, I hear that you don't see a change, any difference. I'm just sharing with you how it looks to me.
Could this rock a marriage?
Absolutely.
Yes, of course.
Absolutely.
Yeah. There's an increase in divorce at this time, like perimenopause, menopause. A lot of women go through, they share their experiences, and research has shown that there is an increase in divorce at this stage of their life.
And I truly believe, statistics are exactly that, high rate of divorce, and that's so sad. Yeah. Because you could have a great marriage, 20 years, 5 years, 2 years, whatever the length, and then the woman goes through perimenopause, and then you break up. Really, when you can just cultivate, it's actually a beautiful opportunity to lean into each other more. And cultivate better communication skills, which comes from listening.
Today we're addressing midlife mindfulness.
Yeah.
What does that mean in relation to perimenopause? Because I feel like we're going towards that direction.
Yes. Well, what's being mindful really about? It's about being self-aware. It's about behaving in a way that is as conscious as possible, right? Being mindful, having your mind open and aware. Now, that there comes a sort of contradiction, because when we're going through, or when I'm going through, I'll have to only speak for myself. When I'm going through my perimenopause phase, and I'm in it now, I have these moments where being mindful is literally impossible. Why? Because my hormones are running the show. My mind has no hope in hell really none at all. As I'm coming to the end of my phase, I'm more aware of the typical behavioral patterns that I might play out as a result of my hormone fluctuations. But I can tell you now, even in those moments when I'm like, oh, I can feel that coming, I can feel my fury coming, it's my effing hormones. Do something about it, Melissa. I'm telling myself up here, I'm being aware, self-aware, and want to be mindful. Can't. But the body, the physical body is literally, for me, being driven by my hormones.
Just takes over.
It completely takes over. So what the practice has done for me is now, the stage I'm at is to remove myself from that situation. So if my partner is there, or someone I care about, or a friend, or whatever, or I'm, like I say, out in public and dealing with someone who's serving me, and I want to kill them because my hormones are everywhere, I excuse myself. I'm like, I need to go to the restroom, or I'll say, excuse me, I have once or twice owned it and said, I'm losing my temper, I need to step away.
Well, we're now going to great tactics. Now, when you do workshops and seminars in this area, are you teaching these type of tactics to people? I imagine these are so important because it's self-management to some extent, isn't it?
It is, and it's ownership. And as women, we have also been conditioned to constantly apologize for who we are and where we are and why we do what we do. Oh, I'm sorry. I'm sorry. I need to create some space. I'm sorry. I need to leave the table. I'm like, I'm not sorry. I'm losing my temper. Own who you are. Take up space. That's the autonomy. That's the agency, right? Being angry is even being shamed. I mean, we shame. Sorry, let me rephrase that. Anger is an emotion we often shame. Every emotion has its place and it's valid. So if I'm feeling angry, anger tells me something needs to change. A lot of the time we want to change the world. I'm angry and I want to change that. But really what we need to do is change what's happening within. Okay, so do I teach these strategies? Yes, and the strategy stems from this. It's always the same thing, becoming self-aware. Noticing, how am I feeling right now? I'm feeling my stomach bubble. I'm feeling my face contract. My heart is beating fast. I'm getting hot. I call this emotion anger. So when anger shows up, what do I need to do? Here are my 3 strategies. Breathe.
Underrated, right?
Right? Totally underrated. And that's the most important thing. I can give you the tips, right? I can put them on social media. I can tell you, email me. I'll give you all the strategies. But how did we start this conversation? We're all different. There's no one size fits all. So what I name as anger in my body, Greg, for you could be anxiety. So what's important is to cultivate that practice of self-awareness, learning for yourself, what does these thoughts that go through my mind, these physical feelings in my body, this intangible frequency, vibration I'm feeling in my body, what do I call it? And when I call it this, anger or anxiety, these are my strategies I employ that work for me. And we only know the strategies that work for you based on you trialing and testing it. So I'll suggest it to you. You go off, you try it and test it, come back to me and tell me what works.
Got it.
Everything is bespoke and curated because, folks, we are unique. That's the most beautiful thing about us. So with these women that came to you, Dr. Iman, right, thinking that they were going through perimenopause, great, wonderful. You're self-aware enough to notice, is it this? Then you go, and this is why also I'm a huge advocate of functional medicine, is you get a picture of you, what is unique to you, what your needs are.
And we're going to come back to the breathing,
Okay.
but we're at this juncture at the moment, which I find is absolutely fascinating. And this is a question to both of you. Is it important to put a label to this? Is it important for women to say, thank goodness? And I think some women do in the clinic. They come to and they go, oh God, I feel so much better. And now I know what I've got. Or now I know my symptoms are, is perimenopausal symptoms.
Yeah.
Is it important for a woman to be able to tick that box and say, oh, at least I can put my finger on it?
I think I do think it's important, because it makes it explains things for ourselves, I mean, I say that in a modern world, and I'm thinking back now to my mother, because in her time, I think menopause research only started in the 1970s, if I believe.
Yeah.
That's only, in fact, that's as old as me. I turned 50 last year. That I find that extremely shocking. We all come from a woman. We are all born from a woman.
Yeah.
This is probably the most important information in research that needs to be out there, right? For everybody, for men and for everyone, right? So I think back to my mum's time, there was no research and she didn't have a label for it. So does it help to have a label for it now? Yes, because I feel then we know how to build a support for it by having a label for it.
Yeah. Dr. Mann, do your patients, when they come through the clinic and they leave the consultation and they're able to connect the dots, I'd say, in some way. When you can connect the dots, does it help?
Yeah, I mean, for me, I think it really helps. Yeah, because I'm looking at how to treat these women, right? And so, it definitely helps me, especially when I know exactly what it is, like, because we're doing a lot of different tests as well, right? And so then if it's something like perimenopause, menopause, for example, just last week I saw someone who's she's got a very good position in her work, in her career, and so she was dealing with severe brain fog. And so then it was something that we needed to do something about, because that's the thing, women usually, they go through these kind of things, but they're already in, like when they go through perimenopause, they're already in a position where they are, in that leadership position, or, they're already far into their career where they need to take in more roles, but they are not able to because they are suffering from all these kind of symptoms. Yeah. Suffering, but that's not a good word, but I mean...
Well, they are, I guess, to some extent,
they are,
right?
yeah. When they do come to see me, they are suffering. And so... for me, I find it's very helpful because I need to know how to treat them. Yeah. And so, like we do a lot of hormone therapy in the clinic, and it does alleviate the symptom. They do feel much better. They do, they can take over whatever that they're going through, they can also feel much better and have a good quality life.
Yeah. It's one cog of the machine, isn't it? The hormone therapy as well. And then coming back, we're talking about breathing. You know what my mum used to say to me when I was little? She goes, "Okay, Greg, look, if you get upset, take a deep breath and count to 10. I don't know if it's an English thing. I'm not sure what it is. But it was really good. And look, sometimes I did count to 10 because my mum made me. And it was helpful. But this is obviously one of the techniques. Well, we know what we do in the clinic here as well, but this is one of your techniques. The first one is breathing.
Yeah.
What are the other ones you employ?
Really removing yourself from the situation is a very powerful one. If you can, and most times we can. You can always find a valid reason to step away.
When you step away, you mean like just get up, explain yourself, or not explain, just walk away?
I need a few moments. I need to get some fresh air. You could even tell a white lie and say, "I'm feeling dizzy. I need to get some fresh air."
Yeah. Or I need to go, because this is great
or
for
I need to
people
go to the restroom.
Yeah, exactly. This is people who are watching this are thinking, God, I've been in that situation 100 times and I've just suffered through it and just like literally gone red and eaten myself up inside, which is, of course, no one wants that. Yeah. So they can just say, "Oh, sorry, I just got to run to the toilet."
Yeah.
And just go into the toilet and sit down and count to 10.
Count to as many. And tapping is another one. Tapping is quite popular. So you see that it's about sort of bringing focus back, grounding yourself back into the moment. Okay, so breath does that; it gets you back into your body. Tapping helps you to focus on one specific area, and breathing as well. Stepping away from the situation basically reduces the energy, the high level energy in that situation. I think it helps also if someone were to give me a very specific scenario, because it does depend on the scenario you're in.
Let's use that example which Dr. Mann raised earlier on.
Okay.
Maybe a woman she could be in her early 40s, C-suite, in a room surrounded by the HR manager, CEO, she's the CFO, you've got all the heads of department, and all of a sudden she's brain fog, and of course brain fog can lead to immediate anxiety.
Definitely.
Because you can't answer the question. What does she do?
I would ask them to repeat the question, and I would own the space. I would say, I'm afraid I lost you there. I lost my train of thought. I was a little bit distracted. Could you just repeat what you just said and own it? Not be fearful that I might lose my job. How am I going to look? How you're going to look is somebody who can own your space, Be honest. It happens to all of us. We all get distracted. Okay. Get them to repeat it. If they don't, and you're still in that brain fog, then I would excuse myself and I say, I need to go to the restroom. Please excuse me.
Yeah.
And from a very extreme perspective, if you let's say you remove yourself, you come back, you're still not great. I would then own the fact that I'm actually I have anxiety, or I'm having a health issue right now. Like, own that, because that also happens.
Yeah. Could that be seen though? And I'm just being frank
I know,
as well. Could that be seen as a sign of weakness? Because, females in the workplace as well, they've had a hard time since very beginning.
Yes.
Yeah.
Could this be a sign of weakness? Could they be, and it's not immediate, but if this happens several times, sidelined?
Yeah, absolutely, 100%. And the thing is, you're stuck between a rock and a hard place, right? Because if you pretend like you're okay because you're afraid that it's a sign of weakness, you're not being truthful. You're not actually showing up at work and showing who you really are. You're not really being honest. And there's going to be a domino effect to that. Because you're going to pretend you heard what was said. You're going to pretend like you understand. You're going to be nodding your head when somebody actually asks a question and they're waiting for you to answer. So you're actually going to look like a fraud, because you are being a fraud in many ways. So if being you and owning the fact that you need support, or that you're going through something at the moment and it's a real health condition, is not going to be supported, you might want to ask your question, is it time for me to move places, move jobs?
Yeah. So
I mean, that's the truth.
That's a fantastic question to ask yourself. And you've got to be conscious enough to ask that question to yourself as well.
And, this is the time where women actually question their position in the workplace. And sadly, though, statistics show that 1 in 5 women actually quit their jobs during this time, this phase, perimenopause, menopause.
So this affects the workforce.
Yeah.
So employers out there, you need to wake up, because you're losing good people.
Yes.
From your lack of awareness of what women are going through.
Yeah.
So now we flip it the other way. Instead of women being afraid to lose their jobs, we're seeing, 1 in 5?
1 in 5, staggering.
That's affecting the workforce.
Yeah.
You've got great employees who don't feel supported, who leave.
Yeah.
I could go on. Do HR departments know enough about this? Do they take this in consideration as well? But the first one we talked about was breath work, counting to 10, such.
Yeah.
Second one is remove yourself from the situation. You mentioned those 3. Can you remember that third one?
The third one now.
I'm putting you on the spot
You
here.
are.
Melissa, I'm sorry about that one as well.
Was it tapping?
You did mention
I did
tapping.
mention tapping.
That's important as well.
For me, it's music. But that's not always possible, depending on the scenario. So if I'm on my own, if I'm working and I have a panic attack, or I'm in the car and I'm feeling anxious, I'm finding I'm having brain fog, and I'm going into my mind going, what's wrong with me? That's where the mental health sort of spiral can start, right? Why are these things happening to me? Why am I having this brain fog? Why can't I remember this? And it sort of exacerbates the experience. I will reach to my toolbox of music, because music calms me.
That's your special place.
That's my special place. And I will go so far to say, it's everybody's special place. We all have a song, or 3 songs that we go to. And how I help people do this as well is I'll say, do you think back of a happy moment, a very joyful moment in your life, right? Or a comforting moment. And maybe it was a lullaby your grandma sang to you. A memory that opens your heart and makes you feel calm and safe and warm. That's your song.
I think, that's very interesting. I do find listening to music is very calming. And then, because you were mentioning feeling a little bit anxious, and then having panic attacks. Some women can go through that during perimenopause and even menopause, right? Because the mental health is affected. You've got that cognitive decline even, right? The brain fog, the anxiety. And that's because of the loss of estrogen. So I wanted to bring it to how important estrogen is to neurotransmitters in the brain.
Right.
So that would be like, serotonin, dopamine, or epinephrine, all these kind of like neurotransmitters that actually help you stay calm or feel happy. And so then when you're having loss of estrogen, you're getting lack of that as well.
Lack of serotonin and dopamine.
Yeah, I mean,
those are the two
it's
that
very much related. And so then it's very connected. And so then these neurotransmitters are very sensitive to the loss of estrogen because we've got estrogen receptors everywhere in the brain, heart, bone, tissue, skin. It's not just the reproductive organs, but we were maybe told or, we believed that it was just very much confined to the reproductive organ, right? I mean, like, menopause means like, the end of your reproductive years, but it's beyond that, yeah. So I think the mindfulness of when you feel those kind of like anxiety, what do you do? Like, I think music is one important tool. I think I find that helpful.
Do they?
As well.
And I wrote down a question here. Is that, do they assist in hormone regulation or rebalancing that moment when you?
What, music?
Yeah, music, mindfulness practices, whatever they would be as well. Do they help with this?
Yeah, I feel it does.
Yeah, definitely. I think again, it's not about a lot of the time we're looking for the fix or the end, right? Yeah. But really, we're in this life to live, to experience life. So the mindfulness tools is about learning to navigate these moments, not to prevent them or even avoid them. It's just to know and be in full ownership that when this happens, and it will happen. And I'll never know when, but I'm confident that when it happens, I have a toolbox to reach into that can soften the experience. I have goosebumps saying this.
Yeah.
That's the power we hold with self-awareness.
I have goosebumps in the fact that now in the clinic we definitely have a holistic approach.
Yeah.
And I like that. But listening to you makes me realize it's not holistic enough. Because what we should do is Dr. Iman, and we have a counselling psychologist. She's fantastic. People love her as well. But what I think we need to do is bring you on board when it comes to the number of perimenopausal, menopausal, postmenopausal, because we're not going to talk about that today. We could be here all year, right? But what I firmly believe is that when we've done our work, and you've done your work, Doctor, and it's great as well, what I think we don't do is we don't talk about management of symptoms. All of a sudden it happens. We're having such a good conversation about how to manage it. That's what they want to know.
Yeah.
That's what women want to know. And they may not say that to the doctor because they think it's something I need to work this out myself. I will just go to the doctor to manage my hormones. And hopefully they'll be able to give me what I need to balance it. But what I feel listening to both of you today is they really need to talk to somebody like you as well, which will complete that holistic circle.
Yeah.
What do you think?
Yeah, I'm totally aligned with that. That's why.
That's why you're here.
That's why Melissa's here, and that's why I, love having Melissa on board always. That's why we did events together, and
But more so.
Yeah, we should do more events for sure, especially perimenopause events.
But also patient management in terms of when we put I'm brainstorming my idea to develop my business.
I mean, I'm all in. It's essentially. I mean, I talked about being a guide earlier. You asked me what do I do.
Yeah.
Really, it's life strategy.
That's it, right?
It's life strategy, and it is bespoke because, of course, there's all the quick fixes out there, and there are the templates, and that's a good entry. But really, what's important is to take those templates, if you're a template person, and try and test it. But it's nice to have someone to guide you on that.
And bring the partner along, maybe.
Oh, absolutely, 100%. This is a bit of a digression, but I'll just mention it because it's about partnership. I have a conscious parenting client, so I'm coaching her how to parent her children more consciously. And she wanted to bring her husband in, and her doing the work on her own helped one level. The minute she brought her partner in, the whole family now live as a conscious family. It is incredible when we lean in to community, and that's what I love about Rosewood Clinic.
Right.
So we're not going there, you're not just seeing your doctor or a specialist or a therapist. you step in. I'll mention Ashley. You get a warm welcome, and if Greg's there, you get another warm welcome, and it really feels like it's an extension of your family community. And we need to do this more. We need to be in community. We need to have these conversations. We need to have safe spaces for us to share our personal experiences and not be shamed for it or not be minimized for it. And I think a lot of the time people's experiences are minimized because there are professionals out there who will say, yes, this is your experience, but this is the right experience to be having.
Yeah.
And so people don't feel heard. Anyway, I can go and talk for days and hours about this, and I won't.
Yeah, but I mean, I do agree that. I do agree with that. We do need to build that community because I think we're lacking that. We don't have that kind of support system, and especially for women. I mean, because with men, it's different. You guys don't really talk much about what's going on.
I think it's even more, right? Even more needed for men.
We go through the, what's it, andropause?
Yeah.
I feel like I've gone through 6 already, and I'm only 45. Well, that's another subject for another day, which would be very interesting as well, which is even less spoken about.
Yeah.
I mean,
Yeah.
If ever.
Yeah, poor men.
Exactly. But we have less hormones, I guess, to some extent as well.
But you have your own set of struggles, and that's not to be minimized.
Yeah.
And I'm going to call out women here. Yes, and I won't say we have it harder. We have it hard. Let's not compare because men and women, men are from Mars, women are from Venus, and all that jazz. But we are different, and to compare does not help.
Yes.
We are women. This is the experience we go through. Do men have it easier? Men have it different, because we as women who are unaware and who are wounded by this difficult perimenopause experience make it harder for men. We can make it harder for men. We can make it harder for our partners, and it's not necessary.
Right.
So I'm putting my neck on the line here, but women out there, let's stop making it harder for our partners by saying, "Oh, you have it easy." They have it different, because at some point your partner is going to need your support.
So,
sorry, I find that really interesting because I would say most of my female patients who come in for perimenopause and even menopause, they come in alone. Every single one of them.
Interesting.
I know.
Where are you men?
I know, right?
But do they come in on their own? Because, do you know what I mean? Do they come in on their own because they haven't mentioned... Do you know, they haven't mentioned to their husbands?
Yeah.
Their husbands don't even know they're there?
Yes.
Yeah.
And also there's the conditioning for women, which is, this is not my husband's business. This is not for him to know about. My women's business is my woman's business. But the world needs to change. We need to change this.
Yeah.
You have chosen someone to be in partnership with, right? And this is a health condition. It's not a woman's condition. It's a life process you're going through. And have you not chosen to is that not your life partner? And there's some things we go through together.
Yeah.
Well, this is where you come into the fold as well in midlife mindfulness, because when they come to us alone, which 10 out of 10 probably do. I don't think I've ever seen a partner, but maybe 9 out of 10 do as well. This is where Dr. Iman and our other doctors can step up and say, look, this is the first step, part of the, and we won't call it treatment plan, but part of the journey would be that I'd like you to meet and with your partner, Melissa. So we can address some of the areas here where we have a professional which will be able to support you on this journey. That might be nice.
Yeah.
Okay,
No, because I'm like, now I'm just thinking, right? I mean, my younger patients, they come in with their partners, their boyfriends. My young female patients who are trying to get pregnant, for example, they're concerned about fertility health. Yeah, they come in with their husbands. And then women who are going through perimenopause and menopause, they come in alone.
Yeah. But even women who have, correct me if I'm wrong, but even women who have, say, let's just say PCOS, endometriosis, and stuff, they sometimes do come with their partners as well.
They always do, yeah.
I mean,
sometimes,
I think there's a lot of shame, though, around perimenopause and menopause for women, because it's very much framed as the one purpose of me being a woman, or what makes me special as a woman, is that I can produce life. I carry life. So the perimenopause and menopause journey is all about this losing that.
Yeah.
So I think, and this is something probably a lot of women are not conscious of. There's some level of sadness and grief actually that we have to go through as women when we go through perimenopause and menopause, and it feels like, what is my worth now? I can no longer bear children.
Yeah. That's
Okay,
true.
last question. God, we could be here forever
Yes.
talking. Good.
It's a
But last
huge topic.
question. A woman who's conscious, she knows, okay, I'm going through perimenopause. What's your advice to them? What's a couple of words, take-home value, which they can feel as though, okay, that's a great starting point?
Okay, I would lean into the fact that this is one of the most beautiful experiences you can have. And you're maybe watching this thinking, is this woman insane? She's just been telling us about her mood swings and her fury and her brain fog and let me frame this to you. It's beautiful because this is the chapter in your life really when you can lean into taking care of yourself first, getting to know yourself first, because you were going through these things. Before we could afford to put our health issues aside and prioritize everybody else. This is the biggest signal from your body, the most important chapter of your life, to prioritize yourself, because your body is telling you, brain fog, take care of that. Low energy, take care of that. Inflammation in the joints, take care of that. Depression, mood swings, take care of that. Cold, hot sweats, night sweats, take care of that. If you don't listen to it, it's only going to get worse. So, coming full circle again, it is the most, and for me, it is one of the most important periods of your life. Lean into it with as much kindness for yourself as you can, and seek help. Seek help. Look for women's groups. I run women's circles. Look for clinics that are communities like Rosewood Clinic. Ask for support, because the support is there, and you absolutely do not have to do it alone. It's much easier together.
Thank you. Dr. Mann,
Yeah.
any final words on perimenopause?
I think it's also important to look into other things beyond perimenopause, because I do see a lot of women who are going through perimenopause with other things. So it's also important to kind of understand that it could be something else that you're going through. But Melissa said, come in to the clinic, seek help, understand that there is support for you. It could be anything that you're going through, but it's just something where you actually need to be guided into knowing what is it that you're going through,
What is
right?
going on?
Yeah, what is going on? Yeah.
Clarity leads
Clarity.
to power.
Absolutely.
I've always loved that saying as well. Melissa, Dr. Mantalia, thank you so much for joining me on the podcast today. It's been fantastic. If you have any questions, please don't hesitate to reach out to the Rosewood Clinic, and we will be happy to organise consultations with any of our doctors, and of course hook you up with Melissa as well. Thank you so much indeed.
Thank you.
Thank
Thank you
you.
for having me.
Thank you, Melissa.